morning. Dana Johnson with Ray Dental Management, here today to talk to you about the three most common battles that I see between the front office and the back office. When I was working in a dental practice, we would constantly be having this issue between the front and the back, and how do we come together and solve these issues that we have between the front and the back. So the three most common battles I see when I'm working with an office, and these are across the board, every office has these issues. The battle of the appointment book. The front office is always saying, there's just too many cooks in the kitchen, too many hands in my appointment book. How do I get the book to stay closed so nobody else schedules in it? Well, for one thing, it's not your appointment book. It belongs to the entire office. So what you really want to try and do is find a way to map out your appointment book. So what it does is it gives your team a little bit more freedom to schedule appointments, so it frees you up a little bit. Also, the back office feels like the front office is so production focused that the back office can't get a patient in when they need to. The back office will say, I need to get a patient in this week, but the front office says no because it doesn't make our production schedule. So that's another thing about mapping out your schedule. So the battle of the appointment book is number one. Number two battle that I see between the front and the back is the battle of the handoff. I see front offices getting very upset when the patient walks up to the front by themselves, or the clinical team member brings the chart, drops it on the counter, and then walks away. No communication whatsoever. And the front office has no idea what to schedule next for the patient. So come up with some kind of system that the patient does not come up to the front desk by themselves. And if they do, make sure they walk up with something like a route slip or a visit form that has some kind of communication on it. You must be able to communicate between the front and the back what the patient's needs are, so that the front office team member has communication, or an inter-office pop-up communication in instant messaging system on your computer. But never bring the patient up to the front office without some kind of communication. Battle number three, the battle of treatment planning. This one I see a lot, where the front office goes to maybe schedule the patient for the next appointment, but there's nothing in the treatment plan. There's nothing either written in the chart or there's nothing in the computer treatment plan. And so my feeling, this is my strong opinion, is the clinical team is responsible for treatment planning. You're the one that's sitting in there with the doctor, and you're the one that hears what the diagnosis is. You know what's first, you know what the priorities are, and so it is the clinical team's responsibility to treatment plan. And if you don't have time, you need to make time somewhere. So if you need to give up some admin task, maybe if you're a hygienist and you are having to schedule the patient for their next visit, pass that on to the front office and make sure you get the treatment planning completed. So those are the three battles: battle of the appointment book, battle of the handoff, and battle of treatment planning between the front and the back. So work together as a team, come up with some systems to help communicate better together, and you won't battle these battles ever again. Thank you. And you can reach me at Ray Dental Management. It's RAE dentalmanagement.com.